Well, thank you all for being here today for this tremendous announcement before us. I would like to welcome today Minister Petitpas Taylor to our island. It is always wonderful to have our federal colleagues come to the province, and I know that she is a maritimer, so Minister, this may not be New Brunswick, but you're a little closer to home than you are in Ottawa, so a very warm welcome to Prince Edward Island. We do hope you enjoy your stay on our island, and we're so pleased to have you with us here this morning. I would also like to recognize our Premier, the Honourable MacLauchlan, and a number of our colleagues from the legislature and from our federal realm who are with us today. With us today are MP Sean Casey, MP Robert Morrissey, and as well with us today MP Mark Miller from Montreal, who is Parliamentary Secretary for Infrastructure and Community. And it's wonderful to have him with us here as well this morning. Also, my legislative colleague Kathleen Casey is here today, and this is the riding or the district that Kathleen represents, so it's very good to have you with us this morning, Kathleen, as well. But before I go any further, I would like to welcome to the podium our local MP, Sean Casey, who will officially recognize the lands that we are here on today.
Well, thank you very much, Minister Mitchell. Il me fait grand plaisir d'être ici parmi vous aujourd'hui et de vous accueillir ici dans la circonscription fédérale de Charlottetown et la circonscription provinciale de Charlottetown-Lewis Point, qui est représentée par Kathleen Casey, qui est ici. I would first like to begin by acknowledging that the lands on which we gather are the traditional lands of the Mi'kmaq people. And I would like to add my words of welcome as well. Mr. Premier, it's always nice to have you here. We have with us, as well as Minister Mitchell indicated, some colleagues from the House of Commons, the Honourable Ginette Petitpas Taylor, all the way from Moncton Riverview, Dieppe. And I'm going to need to refer to my notes on this to get the riding right, but we have the Parliamentary Secretary to the Federal Minister of Infrastructure, Mark Miller, who represents the Montreal riding of Ville-Marie-le-Sud-Ouest, Île-des-Sœurs, all the way from Montreal. Member of Parliament for Egmont, Bobby Morrissey, all the way from Tignish. As I indicated, from just around the corner, my favorite MLA, Kathleen Casey, and of course your host today from Charlottetown-Sherwood, the Provincial Minister of Health, Robert Mitchell. Welcome one and all. Big news today, and it's awful nice to have it in our riding. Thank you.
Well, thank you very much, MP Casey. Well, as Minister of Health, anytime we can come together to announce new initiatives and new funding to better support our health and well-being of Islanders is a good day. In fact, it's a very good day. Islanders deserve to have their health care needs provided for in a timely and appropriate manner. When someone is in crisis, it's part of our responsibility to ensure that we have the resources in place. If an individual wants to age at home, we need to have programs in place to support them as best we can. This is part of what today's funding agreement is all about, ensuring that we have a continuum of care which is reaching the needs of Islanders where and when they need it the most. So without further ado, I am pleased to welcome to the podium our Federal Minister and MP for Moncton, Riverview, Dieppe, the Honourable Ginette Petitpas Taylor.
Well, good morning, everyone, distinguished guests, friends, and colleagues. I have to say it's an absolute pleasure to be here in Prince Edward Island. Yes, I may not be too far from here, but it's always great to be in the Maritimes and just to meet with local friends and colleagues, and especially for these great announcements that we have today. Sean, thank you so much for the warm introduction, and I want to thank Premier MacLauchlan and Minister of Health, Robert Mitchell, for hosting us here today as well. And also special greetings to Bob Morrissey and Mark Miller as well. Thank you so much. I feel like as if it's kind of home away from home here today from Ottawa. I have to say, over the past week, we've been in our ridings, all of the ministers and all of the MPs across Canada. And this week, we've really had some great announcements. We were in Moncton, New Brunswick for the Atlantic Growth Strategy, had some wonderful work that's being done there. And then today, we're able to be here in Charlottetown for a really great announcement. Fait qu'encore une fois, merci à tous pour l'accueil chaleureux. C'est un plaisir d'être ici parmi vous aujourd'hui. Nous sommes ici ce matin car nous souhaitons offrir aux Canadiens et aux Canadiennes les meilleurs soins de santé. All Canadians expect the healthcare system to adapt to their changing needs, especially as we grow older. That's why that our government committed $11 billion over 10 years to provinces and territories to improve access to home and community care and mental health care and addictions. As someone with an aging parent myself, I can tell you I understand how important it is for families to have access to services outside the traditional setting of a hospital. And as a former social worker, I have seen firsthand the importance of all the added care we can provide for families that support a loved one who suffers from mental illness or struggles with substance issues. I can tell you, before I entered politics, I was a social worker for 25 years and worked on the ground, and we certainly see the importance and the need for mental health services in a timely basis. These are issues that touch all of us. This funding will help improve countless families with much needed additional support. So today, I'm extremely pleased to be here to sign a bilateral agreement on funding and reporting with the government of Prince Edward Island. L'attente que nous signons aujourd'hui précise comment l'île du Prince-Édouard investira dans les 5 prochaines années plus de 20 millions de dollars pour les soins à domicile et en milieu communautaire, ainsi que pour les services de santé mentale et traitement des dépendances. Cet investissement appuiera les programmes de l'île du Prince-Édouard qui amélioreront l'accès aux services. For example, the Mobile Integrated Health Program will support PEI's paramedics in providing palliative and home care services to patients in need. Very similar project that was launched actually in Ontario a few weeks ago. So very great program. Also, the Student Wellbeing Program will improve access to counseling services for students facing mental health issues. And once again, we certainly know that that's a priority. Programs like these will help ensure that Islanders can get the care they need where and when they need it the most. By ensuring that everyone receives the best care possible, we are making it easier for Canadians to make meaningful contributions to their communities and the economy. And together, we will measure our success with a common set of indicators. This agreement that we're signing today demonstrates PEI's action plan to improve access to primary health care services and improve palliative care to support those living with the needs. So once again, I truly want to take this opportunity to thank the leadership, the province of Prince Edward Island, for being able to come up with an agreement that we're able to sign. And again, we continue and we look forward to working collaboratively in the months and years to come. So thank you so much. Merci beaucoup tout le monde.
Well, thank you very much, Minister Petitpas-Taylor. And obviously, collaboration between governments is so important for healthcare to be progressive. And I know my Premier will agree when I say that enhancing access to home care supports and strengthening our mental health and addiction services are and continue to be priorities for our governments and for Islanders. And what we're doing here today will be so important for our children, our youth, and our most vulnerable seniors as well. So it's great. It's a great announcement today. With that said, I would now like to call upon our Premier, Wade MacLauchlan, to come and say a few words at the podium.
Thank you, Minister Mitchell. Good morning, everyone. Bonjour tout le monde. It's a pleasure to be here together with all of you this morning at the Prince Edward Home to speak about these further developments in healthcare in its fullest sense in our province. And I want to join in acknowledging the special guests who are here, Ginette Petitpas-Taylor, our MPs, Sean Casey, Bobby Morrissey, and Mark Miller, MLA Kathleen Casey, who's very proud to have a number of great institutions and facilities in her district of Charlottetown, Lewis Point. And I also want to recognize the leadership and representation here from the healthcare community and Health PEI, And of course, thank the media for being here. It's very important that this be about public engagement, and that people appreciate that health is a common endeavor. And in that sense, you might say, Minister Petitpas Taylor, that the motto or the theme of what we're doing together here today is captured by the podium, where it says spirit of cooperation, l'esprit de coopération. And if we were in any doubt about that, I know the group out in the outside was singing side by side, so they must have had that on special request. En tout cas, c'est un plaisir de vous souhaiter un bienvenue, Madame la Ministre, un bienvenue chaleureuse à l'île du Prince-Édouard, et de reconnaître que vous êtes ici en votre capacité de ministre de Santé nationale, et aussi d'un compatriote des Maritimes. We had our time together on Tuesday, as the Minister said, on the Atlantic Growth Strategy, and this is another opportunity today to see the cooperation and the results that are being produced for citizens because of the effective cooperation of the federal and provincial governments, and in particular in the area of health, which is so important as a priority for both of our governments and, of course, for our populations, as you have commented, Minister. And it is about providing the right care in the right place and at the right time, and indeed by teams that are collaborating in ways that are providing an ever more effective service. And it's in particular, of course, to recognize that we start with a foundation of strong teams, of people who work together with communities, with families, with community-based organizations, to ensure that we're doing the most that we possibly can to serve the needs of our population. And this further announcement today comes together with very significant investments last year on the order of $650 million in the province, a full 40% of our provincial resources dedicated to effective health care and the improvements that we make on a continuing basis as we move forward in this area. And the announcements today of the bilateral agreement and the dedicated or targeted funding around health care and access and supports in the home care context or the community context, and in the area of mental health and addictions. And it's very timely, of course, to make these investments together with others. In a sense, you might say that what we're doing here today is getting further upstream in the community in a timely way, and in particular with collaborations. In the area of mental health, Minister Mitchell spoke, and you spoke, Minister Petitpas Taylor, about the student support teams. And that's a great example of what we're able to do with existing resources and these additional resources to bring together in the school context multidisciplinary teams, multi-professional teams, teams that work together with the community to address concerns, anxieties, issues that are arising for our students, whether they're in a kind of a formal sense, mental health, or other issues that people are struggling with. The earlier that we can address those in, I'll call it a non-institutional context, the more likely we will be to ensure that people then are in a position to be independent, to have productive lives, and to continue to be well and to do well. And in the home care context, it's a great parallel to have the effective collaborations, transitions, a very big part of this. We've got the leadership here of our senior care group in the province to ensure that seniors have the ability to be independent, to be in a place where they are well, where they're confident, where they are close to the people that matter to them the most, to the community, that they know, and and all of the research tells us this, where they've got a much better chance to stay well longer and to stay independent. And indeed, that's what these investments today are all about. And I think it's so important in identifying these initiatives and this bilateral agreement and targeted funding to recognize that it comes in a context where there are strong teams, where there are professional collaborations. Indeed, that's one of the things that we discover in both health care and in mental health, in home care rather, and mental health and addictions, is that much of the further service that can be delivered, and especially in a kind of a proactive and an upstream way, is going to come through multidisciplinary working together. And we appreciate those who are here, and of course the thousands of people that they represent for that effective service. And we recognize that we are making headway, in our province to take mental health and addictions. We today have hundreds, literally hundreds of islanders, older islanders who are able to be served by mental health resource teams for seniors, younger islanders who are being served by programs such as the school support teams or our strength program or our insight program. Each month people are getting service, walk-in clinics that were not available as recently as a year or two ago. So that's where you really see the benefit and feel the benefit, and all of us kind of feel that and appreciate it. So my part in this is to say how much we appreciate the side-by-side approach, and how much our fellow islanders, that's to say all of us, benefit from that collaboration that is being supported by these investments today. So merci tout le monde, merci à ministre, and we look forward to continuing to work together with all of the great people who are delivering health care and working together to continuously improve what we can do for our citizens and for islanders. Thank you.
Thank you very much, Premier, for that great message. And at this time, the Federal Minister, the Premier, and myself will be signing the official bilateral agreement. So any media that are in the room that would like to are more than welcome to come forward and take some photos if they would like to.
Of course, if the minister was going to make sure that this goes as far as it can. Great.
So again, thank you all for being here today. This has been and will be a collaborative process in bringing together officials from the Department of Health and Wellness, Health PEI, and representatives from palliative care, hospital services, home care, emergency health care, education, senior services, mental health and addictions, and many, many others. But before we conclude today, I'd just like to take a quick moment and recognize our senior officials who are here today, who have done a tremendous amount of work on this file and probably most of the heavy lifting for certain. So with us today are Keith Dewar, CEO for Health PEI, Alex Macbeth, Vice Chair, Health PEI Board of Directors, Verna Ryan, CAO of Mental Health and Addictions, Jamie McDonald, CAO of Long-Term Care, Emergency Health and Hospitals East, Dr. Andre Sellier, Chief of Family and Community Medicine and Hospitals West, Mary Sullivan, Director of Home Care, Palliative Care and Geriatric Care, Dr. Morel LaCours, Medical Consultant for Palliative Care, Marion Dowling, Chief of Nursing, Allied Health, Patient Experience, Anna McDougall, Director of Long-Term Care, Dr. Michael Corman, Principal Advisory for Seniors Health, and Sean McNeil, our Senior Policy Advisory. Thank you to each of you for being here today. And as well, Shelley Connick and the staff here at the PE Home, I want to thank them for hosting us today as well. Thank you very much for doing that. So folks, this concludes our formal announcement. The Minister, Premier, and myself will be available for one-on-one media interviews and some official photos. And thank you all for being here today. This was a great day, a wonderful announcement that's going to make a significant difference in the lives of many Islanders. Thank you very much for being here.